Hello, my name is Chatushka Samadhivakara and today I am going to do my presentation about Cushing disease. This is my name and the date that I am doing my presentation. I am using this slide as a flashcard. Definition of the Cushing disease. Cushing disease is an excessive production of adrenocorticotrophic hormone by the body. It is also known as hypercortisolism. The classification and etiology of the disease is that Cushing disease falls under the Cushing syndrome. So there are three forms of Cushing syndrome. One is pituitary form. It results from excessive adrenocorticotrophic hormone by a tumor in a pituitary gland. The second form is adrenal form. It caused by a benign or a malignant adrenal tumor. The third one is the ectopic Cushing syndrome. It caused by a non-pituitary ACTH secreting tumor such as small cell carcinoma in cancer, which secretes ACTH and rarely CRH, which causes Cushing syndrome. Other than that, Cushing syndrome also results from long-term therapy with one of the potent pharmacological preparations of glucocorticoids, and this form is known as iatrogenic Cushing syndrome. Clinical manifestations of Cushing syndrome. The major manifestations of Cushing syndrome represent the exaggerations of many actions of cortisol. Altered fat metabolism causes pendulous abdomen, moon face, and buffalo hump. There is muscle weakness and extremities are very thin because of the protein breakdown and muscle wasting. In advanced cases, the skin over the forearms and legs become very thin and having the appearance like a parchment. Purple stretch marks from stretching of the catabolically weakened skin and subcutaneous tissue are distributed over the breasts, abdomen, and thighs. Also, osteoporosis may develop because of the destruction of bone properties and alterations in calcium metabolism. It results back pain, compression fractures of vertebra, and rib fractures. Also, calcium is mobilized from bone. It causes renal calculi. Since glucocorticoids possess mineralocorticoid properties, it causes hypokalemia as a result of excessive potassium excretion and hypertension resulting from sodium retention. And the inflammatory and the immune responses are inhibited and causes the increased susceptibility to infection. Also, cortisol increases gastric acid secretions, which may provoke gastric ulceration and bleeding. An accompanying increase in androgen levels causes hirsutism, mild acne, menstrual irregularities in women. Excess level of glucocorticoids may give a rise to extreme emotional liability as well. Especially children with Cushing syndrome tend to have obesity and grow more slowly than other children. Women may have excess hair on their face, chest, neck, abdomen, and thighs. Menstrual periods become very irregular or stop for women. Men have decreased fertility with lowered interest in sex and may have erectile dysfunction. Not everyone with Cushing syndrome has these symptoms, and it makes it hard to detect. So the most important diagnostic tests used with the expected results are the diagnosis of Cushing syndrome depends on the findings of cortisol hypersecretion. So the determination of a 24-hour excretion of cortisol in urine provides a reliable and practical index of cortisol secretion. One of the prominent features of Cushing syndrome is loss of diurnal patterns of cortisol secretion. So that diagnostic test is very important. And the other one is the overnight 1 milligram dexamethasone suppression tests, as it is used as another screening tool for Cushing syndrome. Other tests include measurements of plasma levels of ACTH. Adrenocorticotrophic hormone levels should be normal or elevated in ACT-dependent Cushing syndrome, which is Cushing disease, and ectopic ACTH, and it should be low in non-ACTH-dependent Cushing syndrome, like adrenal tumors. And various suppressions and stimulation tests of HPA system are performed to delineate the cause further. And MRI or CT scans are performed for locating adrenal or pituitary tumors. Briefly explain one of the differential diagnoses. Cushing syndrome may be mistaken for other conditions like polycystic ovarian syndrome and metabolic syndromes because they have many of the same signs. Polycystic ovarian syndrome is a condition in which women have high levels of male hormones, which causes increasing the chance for irregular or absent menstrual cycles, infertility, obesity, ovarian cysts, heart disease, and diabetes. Also, the illness is linked to insulin resistance. Mention possible complications. Cushing syndrome can cause health problems such as heart attack and stroke, blood clots in legs and lungs, infections, bone loss and fractures, high blood pressure, and unhealthy cholesterol levels, depression or other mood swings, memory loss, or they having trouble concentrating as well, type 2 diabetes, insulin resistance, and pre-diabetes too. Although the Cushing syndrome can usually be cured, it can be fatal if not treated. That's about it. Thank you.